Hello, my name is Dr. George Rogu from AdoptionDoctors.com, the go-to place for domestic and international adoption medical education and consultation services. Today I'd like to speak to you about fetal alcohol syndrome, what an adoptive parent needs to know when adopting domestically and internationally. Can fetal alcohol syndrome be distinguished by physicians? It is well known that exposure to alcohol during pregnancy affects the infant. How much, how long is really not known, but there's no good amount of alcohol to be consumed during pregnancy. I've seen many medical reports that say that the mother had consumed alcohol at the beginnings of the pregnancy and then had subsequently stopped drinking once she determined that she was pregnant. And that's a good thing. People that continue to drink during the duration of the pregnancy, that could only be a problem as the child develops. Now, alcohol use during pregnancy is laden with developmental problems that can range from simple learning disabilities to severe mental retardation. To properly diagnose fetal alcohol syndrome in a child, there must be a documented prenatal maternal alcohol consumption. And there's also other signs, clinical signs, which are often neurological, that may also be attributed to this. Now, there are two types of alcohol disorders that can be that can develop during the pregnancy. There's the full-blown fetal alcohol syndrome, which is a group of things such as growth retardation, neurodevelopmental disorders, facial characteristics that I'll show you later that are significant for fetal alcohol syndrome, such as short palpable fissures, a thin upper lip, mid-face, flat mid-face. The alcohol-related neurological developmental disorder, basically, that one has some of the neurological signs, but does not include the growth delays. Some of the features that we can see in a child that has fetal alcohol syndrome must include at least two of the followings. There's a thin upper lip over here. There's a rounded, indistinct philtrum. There's a mid-face flattening. There's a flat nasal bridge, small palpebral fissures, apicanthal folds, a small head size, a small chin, and abnormal palmar creases. Now, I'll show you some a classic picture that you find all over the internet of a child that has fetal alcohol syndrome. You can see that the child has a thin upper lip. You can see the rounded indistinct philtrum. You can see that there's a flattening of the face, upturned nose. You can see there's a flat nasal bridge. You can see that the child has a small head, a small chin. Some of the neurological developmental effects in these children are severe mental retardation, which is rare, but some mild retardation is common. These children can have hyperactivity, poor attention span, poor short-term memory. They can have some coordination problems and poor judgment. They are also associated with poor impulse control and gross motor development, and they have sensory hypersensitivities. Growth delays may also occur during the prenatal or postnatal period. Growth delays in children with fetal alcohol syndrome basically have what's called symmetrical intrauterine growth delay, which means they're small all around, head, weight, height, all of it. They're born small for gestational age. We find that there is usually alcohol exposure during the third trimester of the pregnancy. But with good nutritional intake and follow-up later, many of these children do well and they do catch up. but they do usually remain below average size in their height and in their head size. Some of the issues that are often experienced by families with these children born to fetal alcohol syndrome, oftentimes it's behavioral problems. That's the most problematic. As infants, these babies tend to be very irritable and have a poor sleep-wake cycle. Older children tend to be overstimulated during social situations, hypersensitivity and mood swings and aggression, and there is also an increased incidence of ADHD, attention deficit disorder, in these children. It is often difficult to make the diagnosis of fetal alcohol syndrome or alcohol-related developmental disorders, but this is made with a good live physical exam. During the medical records evaluation, we try to do a makeshift physical exam by looking at pictures, looking at videos, and seeing if any of those characteristics are there. Unfortunately, there's no test that can test for fetal alcohol syndrome, but generally the diagnosis is made if there's some clinical features on the medical report, clinical features on the pictures, or any mention on the medical report of neurological signs, and of course if there's any documentation that the mother abused alcohol during the pregnancy. The good news with fetal alcohol syndrome and post-adoption is that if they do receive their early intervention services, many of these children tend to progress and do well and function properly in society. Now, some final thoughts on fetal alcohol syndrome. Just because there's alcohol use on the medical report, that does not mean that there will be fetal alcohol syndrome. No one knows how much is too much or how long is too long. All we know is that alcohol in general is bad. So I try to, when evaluating a medical report, state that if the mother did use alcohol during the pregnancy and then she stopped, that is a positive. If the report says that the mother abused alcohol during the pregnancy throughout the entire duration of the pregnancy, then the chances of fetal alcohol syndrome are much higher. Remember, alcohol use in some cultures is considered normal behavior, even though they know that during pregnancy it could be detrimental to the developing infant. I've learned that if a mother uses a short period of alcohol, chances are that the risk is lower, but if she uses it during the entire pregnancy, the chances are much higher for fetal alcohol syndrome. So once again, my name is Dr. George Rogu, sharing some information on fetal alcohol syndrome and the medical reports. If you're ever in need of medical record evaluations or education, feel free to visit me on adoptiondoctors.com, the go-to place for international and domestic international adoption education and services.